Surgeons at Toronto's Sunnybrook Hospital are pioneering a new procedure treating conditions like PTSD. It's a method that involves implanting a pacemaker-like device in the brain. And while it is invasive, it could have life-changing results for those who are suffering from the disorder. Joining us this morning is one of the surgeons who is involved in this project, Dr. Nir Lipsman. Good to have you with us this morning.
Thanks for having me.
Before we get a look at how the procedure is done, I want to look at the why. According to Stats Canada, about 8% of Canadians will develop PTSD at some point in their life. We know, given that we already have medications and therapies available, why is your team experimenting with deep brain stimulation, considering it's so invasive?
So it's not for everybody, for sure. So the main way that we treat PTSD is, as you said, with medications, with psychotherapy, with trauma counseling. But for those patients, and it's estimated that up to a third of patients who don't respond, surgery becomes an option.
All right, let's get to the how. How does it work?
So it is a pacemaker-like device. There's two parts. There's a battery that's placed underneath the collarbone and electrodes that are placed in the brain. So just like you have pacemakers for the heart, for different heart conditions, for example, that stimulate the heart when the heart needs it. Here we stimulate the brain in areas of the brain that we know are important for PTSD.
So incredible to be working on the first of its kind. In fact, this is you in the video doing this surgery on one patient. How is this person doing so far, and what happens next?
So it's early on in the study. So she was the first patient really in Canada to be implanted for specifically post-traumatic stress disorder. It's too early to say. It takes several weeks to months to really see how patients respond. It's very important that they continue seeing their psychiatrist, continue receiving the treatments that they're important to receive, but they're doing well, and the hope is to really expand the study to more patients that need it.
I think a lot of times people feel like PTSD is something that you can't see. You see the effects of, and you see the symptoms of, but unlike, you know, like a broken arm or bruise, you can't see it necessarily in the brain. How do you go about treating that?
No, I mean, this is, it speaks to the underlying, issue with all mental illness, which is the fact that you can't see it, but nevertheless, it has a huge, profound impact on people's life. It's very important that we see it as no different than anything like cancer, diabetes, etc., and really throw everything that we have, the best that we have at these patients so that we can really get them better.
It is a fascinating first. It's happening right here in Canada. You were the surgeon who worked on this procedure. Thank you so much for being here this morning.
Thanks for having me.
All right.